right there and you'll be able to see the, hey! That was a quick cut. Welcome to Modern Art Blitz. My name is Matt Gleason. I'm your host for an hour of discussing modern art in a blitzed fashion. Totally sober. You?
I'm pretty sober right now.
Really?
Yeah.
To your great regret?
Oh, I have like super potato brain right now.
Super potato brain?
Yeah, potato brain.
You mean like Mr. Potato? We could add a nose to you like that? No?
Yeah.
Yeah. So this is my lovely intern Eliza. She's in the sketcher seat. She'll be sketching our guests as we discuss their art careers, and their art outlook on life. Do you have an art outlook on life? Maybe you just have an outlook on life. We'll find out. I have three guests today. Later in the show, Leslie Langsinger and F. Scott Hess. But right now, he's an artist. That's how he got on the show. Dominic Quagliozzi. How you doing?
Man, great to be here.
Great to have you. So, so tell me now, you're an artist. How long have you been an artist?
Sometime.
Like some people say, my whole life since my mom put the artwork on my refrigerator. Yeah.
I've always drawn.
You were the kid who could draw.
Yeah, I was. Sold Disney drawings to my elementary school kids, friends, for like 25 cents.
Make me Beauty and the Beast.
So I guess that's...
Make me the Little Mermaid now. Right?
Yeah, exactly.
Yeah?
But really, I didn't start becoming serious until probably undergrad.
Undergrad. You were an art major?
Actually, I wasn't. I was a sociology major.
Ooh.
And
career opportunities, baby.
Interestingly, though, that kind of like really fostered more
interest in art?
Yeah, more interest in art, the kind of art that I wanted to make. And I took all the painting classes that I needed to be a double major. So I ended up being basically a double major.
Where was the undergrad at?
Providence College in Rhode Island.
In Rhode Island?
Yeah. Mm-hmm.
And where'd you go? Then you got a master's in art?
Yeah, then I moved to LA, met my girlfriend, then now wife, Deborah.
You met her? Oh, you met her there? She's from Rhode Island?
From Massachusetts.
Oh, she's from Mass. You're from Rhode Island?
I'm from Mass. But
You're both from Mass. You went to school in Rhode Island?
Yeah. So we met and we said let's go to LA and just do our thing.
Real quick Massachusetts question.
Yeah.
Okay, Massachusetts, Irish mob, Rhode Island, Italian mob. Who's easier to work with?
Well, it's interesting because I think I have a godfather that kind of disappeared. He was my dad's uncle. My dad's Italian from Italy, and I used to get the best gifts from my godfather. And one just all of a sudden he disappeared. So I wouldn't mess with either of them.
You wouldn't mess with either of them.
No.
Okay.
So
enough said.
Yeah.
So we're looking at some of your art right here. This is a painting from.
This is a painting from a few years ago, I think 2015. And so a lot of my work revolves around autobiographical issues in my life, mostly medical issues and my health experience in life as a patient and dealing with cystic fibrosis, a genetic disease. And then most recently, the lung transplant, the transplant process, waiting for a transplant and getting a transplant. So this painting is just, it's called Blanket Mountain. It's just, I did some sketches while I was in the ICU, and then when I got back to my studio after I was discharged from the hospital, I painted this. And it's just kind of like these, these notions of what it's like to be in the ICU, the kind of...
You painted this while you were in the ICU?
I did the sketches, and usually watercolor sketches to kind of put everything in its place, and then I make it larger on canvas as paintings in my studio.
And what year is this?
This is 2015.
Was that
2014.
Before the transplant?
Yeah.
So that was when you were in the hospital just for problems because of the CF?
Yeah, I was in the hospital, probably 4, 5, 6 times a year for 2-3 weeks at a time. So
wow.
It was pretty, I was in the hospital a lot. My hospital room usually became my second studio.
Now, did the nurses wow, you're an artist, did that make you kind of a special patient?
Yeah, but it was always corny, really.
They would say things like, are you moving to France?
Yeah, they would say what do you paint? Do you paint still lifes? And then it's always oh, my mom or my grandma paints.
Yeah.
And then it builds rapport with the nurse, and nurses are great, but in terms of like legitimate art conversations, it's kind of hard to come by in the hospital.
But did anybody ever walk up and just say, you know, the Clifford Still Museum in Denver is really nothing like that? No, you never hit the lottery?
So I go to USC here, and I had my transplant at Stanford. And so they kind of know about LACMA and the Hammer down in LA, and they kind of know about the SF MoMA and the De Young up there. So, I mean, there is a little bit of knowledge there, but overall, it's not.
Now, what's travel like for you if you are, you know, do you have to like make sure if you're traveling that you know like the nearest lung doctor, lung specialist?
Yeah, traveling is difficult. It takes a lot of logistical planning. I had the transplant in 2015, and I waited a year till I was fully recovered, and then I was allowed to travel outside of the country. A trip that my wife and I had been planning for 4 or 5 years. So we finally made it to Paris, and while we were there, I had located a cystic fibrosis clinic, just in case. But luckily, I ended up needing services there 4 different times for a low white count. So I went, and it was really interesting because the nurse that I met, that was the nurse manager for the clinic, she was a nurse in Seattle for about 9 years, so she spoke perfect English.
Oh, you got lucky.
Which, yeah.
In France, totally, that's like, oh man, that's
it was Cochin University.
The universe is smiling on you when you get a French person who speaks English.
Exactly.
Woo,
so
man.
that was like a huge relief for us because my white count was like critically low.
Oh.
Like if I was here, they would have put me into an isolation room until it came back up.
Wow.
So I got some treatment for that, and it kind of came back up, and we resumed our trip. But it was, those type of things happen a lot.
Okay,
wherever I am.
But does it inspire you to like, let's stick close to home?
No, because
you want to live for today, baby.
Exactly. That's why I got the transplant, to keep doing that.
To
We're
keep
smart
living.
about it, but it does kind of present problems.
So what are we looking at here? There's a lot of text in this piece.
Yeah, so this was like one of the first pieces I've made right after I got the lung transplant. And I was kind of reflective for a long period of time after, and it's getting new lungs from a donor that had passed away. And my donor was an 18-year-old man, and it's a really humbling experience, and the feelings are so complex. But this piece, it just kind of came out like this idea that bodies aren't archival.
That's why we make art, though, right?
Exactly. And so this one is a little bit of a art joke too, because the original in the top left is just graphite on paper. Which is acid-free paper.
Oh, well, okay, that's a little, that's archival. Okay.
But the other 3 are just photocopies prints from just like a regular Canon printer, manipulated in Photoshop. So and those are not archival.
Okay.
So who knows what will happen to that in the future? But
is a commentary on art itself in a way.
Yeah, art and body. And
now, do you get any information on your donor? You said he was 18. Do you know the cause of his death, or? I
don't know any of that. I may eventually be able to find that out if I eventually get connected with the donor family.
It's the donor family's decision.
It's my decision and the donors.
Oh, okay.
So we both write letters, and they go to the UNOS office, which is the organization that kind of oversees all of the transplants in the country. And if both me and the donor family agree to want to be connected, then we're connected. And at that point, we'll be able to.
You would be able to learn.
I'll be able
but it's
to
going to
learn.
be, they're going to have to say, forget our privacy, you're going to have to say, forget my privacy.
Exactly.
Does that happen a lot? Or did the doctor say that happens a lot? Or?
That's interesting, because I would think that a lot of people would want to connect, because it's a pretty significant event that happens. It's very unique and a special thing, but it's probably about a 50%.
50%? I still think that's high, because I think people, a lot of times, let's just move on.
Yeah.
Or, okay, so wow, is this, first, how big is this artwork?
It's actually a tiny digital piece.
Oh my God, it looks mural size. Like this
Yeah.
could be like, that's in an airport lobby, just.
Yeah,
you know.
it's 4 individual pieces. And so basically the heart of my practice is making work spontaneously in the moment of having a patient experience. And the autobiographical journey that I want to communicate with other people to start a dialogue about health and sickness and chronic disease and all these issues that kind of taboo to talk about. I mean, so this piece I did, I was having a endoscope procedure. They go through your nose down into your stomach.
Oh, wow.
With a camera, and then they put a little monitor on your esophagus that stays there for 24 hours to see if you have heartburn and reflux, because reflux with new lungs could cause rejection.
Ooh.
So this is a procedure you get after the transplant. And while I was, so the first one is getting the medication, getting it prepped, and then the second one is having some of the, the tools stuck in my nose, they actually use cocaine, 0.8% of cocaine to numb your nose, which is hilarious.
Well, we gotta love medical science, eh?
And then, so it's just the journey. So I take selfies and then I just digitally paint on my phone. And these are the results.
And no cocaine habit?
No.
They don't. Do they warn you ahead of time? This is slightly addictive.
No.
In legend.
No, they don't.
No, they don't. They did. Did you find out later? Like, hey, you were coked up, by the way.
No, they tell you what it is. They use lidocaine and cocaine.
I came in here for medical marijuana, and you're giving me cocaine.
Yeah,
I kind of like this hospital.
Right. So.
And morphine. I mean, hey.
Well, my favorite is Versed. I get that for bronchoscopies. It's
Versed?
Versed. It's
Okay.
It's a drug. It makes you basically instantly drunk. In a way, like you lose all your inhibitions. I say like the raunchiest stuff.
We could have had you pop you know what? You could give, coming up next on Modern Art Blitz, Scott Hess, you could give him your Versed tablet, and they could just write out. Well, but I think he's going to be that way anyway.
It's highly controlled, but it's like really the only reason to look forward to any of these procedures.
Is you get a little high out of the deal?
You get a little fun. It's very short time too, because then after that you kind of pass out.
You pass out. So there's the misery. The end of the misery is this kind of blissful, what is it, a half hour maybe?
Yeah, probably, 15 to 30 minutes.
And sleep. Now, is all this harder on your wife, girlfriend?
Deborah. Yeah.
Deborah, is this all harder on her than you in a lot of ways?
I think so. And we try to manage how we kind of function in this lifestyle. It's a weird lifestyle. She's kind of averse to any medical issues at all, like any medical procedures at all. And so I try to do as much as I can to, not protect. That's kind of she doesn't need protection because she's a strong woman, but just kind of keep my physical stuff to me, and she supports me emotionally. And
you don't sit there and go, so I'm going to be doing this procedure, blah, 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 blah. You just say, hey, I got to go in, and she goes, okay, we're going in.
I tell her, she's there with me, and we go, she hears the risks and stuff. I mean, it's intense. It's intense. The transplant was pretty epic.
How long were you out?
For the transplant, it took 14 hours.
Wow.
So it was pretty. I don't know what I would do.
Do they give you your old lungs?
I was able to see my old lungs. I wish I put a slide in that.
Wow!
Yeah.
You could. So you have documentation of your lungs.
Yeah.
Does a CF lung look radically different than a normal human lung?
Yeah, a CF lung looks like basically if you overcooked a pound of ground beef and it caught on fire.
Oh.
And basically that's what it looked like.
Oh, they're really.
It was all like chunky and brown and it's disgusting.
Wow.
Yeah.
What do they do with it after? Do they take it to a medical school or?
So yeah, Stanford has it's actually funny because they call it the gross room.
Oh, okay. I have a feeling it goes into a gross room. Well, was it gross when they started though?
Yeah. So it's in there, and they do research on it, and they do tests to see what advancements they can make, what kind, and they also test it for things. Like cancer, to make sure that
they just want to know, like, okay, this was so. Now the survival rate of CF it's growing every year, right? Because people had fundraisers over the years and raised money for it and stuff. So what is the average lifespan of a CF patient?
Right now, it's probably, I would say, 35 to 37 years old, because there's a lot of new treatments that kind of lend towards a more manageable.
Okay, without a lung transplant.
Without, yeah.
Okay, with a lung transplant.
If you were born right now.
Okay, if you're born right now. What about with a lung transplant?
Well, it's variable. The lung transplant is like just a trading off of disease, really, because it's not a cure. Each year I'm out from the transplant, my survival rate goes down.
And that's because of other factors?
Yeah, the low immune system, you could get issues that damage the lung.
Because of the rejection problems, you have to lower that. And because you have a lower immune system, there's a side effect, could be all sorts of things.
Exactly.
Okay.
My chance of cancer goes way up.
Way up.
All these different issues. I just had a piece of skin removed on Monday because it came back, not cancerous, but abnormal, and with the meds I'm on, suppressing my immune system could eventually be.
Oh, so you gotta stay on this stuff, right?
Yeah, I stay on.
It's a full-time job.
It is. It's very
So,
difficult.
let me ask you about your art. What's the picture here?
So this is, a lot of people recognize, it's the Urban Lights by, at LACMA by Chris Burden. And I did this a few years ago, like 2012 actually. So I was pre-transplant. I was on a course of IVs pretty much 5-6 times a year, 2 weeks, IV antibiotics. And when I'm on IV antibiotics, I can't do that much. Sometimes I do a little bit of work, but my favorite thing to do is go to museums and kind of just stroll around and just chill and just enjoy the art and kind of go to a different place. And I see this piece all the time. It's iconic for LA. But I wanted to kind of he makes this famous statement that he's usurping the function out of these street lamps by making them art. And so I wanted to put function back into it. So I took all of my IV bags and I went there for an afternoon on a Tuesday, and I put a clip on one of the lights and I hung on my IV bag and I did an infusion of this antibiotic, and I made it an IV pole.
Wow.
And it was weird though, because there was like a 5th grade field trip that day.
Oh boy.
So I'm sitting there and these 10-year-olds just come in a wave.
And they're running, right?
And they're like totally freaked out, stopping their tracks, and like a security guard came over. Luckily, LACMA was super cool about it. They didn't say to leave or anything, and it ended up being a great performance.
Didn't offer to put it in their permanent collection?
No, I wish.
So
maybe you could help me out with that.
Well, we'll see. Dom, thank you so much for being on Modern Art Blitz.
Had a great
time. We have a wonderful. We have from the Skechers seat your portrait.
Nice.
Hey, you look a little James Dean-ish there. Okay. Dominic Quagliozzi.
Thank you.
Thank you for being on Modern Art Blitz.
Thank you.
We'll be back right after this.